Hi everyone, my name is Vanessa Kaczynski. I'm a Doctor of Nurse Practitioner candidate at Wagner College. I'll be talking about increasing the knowledge of screening for adverse childhood experiences and its effects on cancer susceptibility. Learning objectives. Upon successful completion of the educational intervention, the participant will be able to 1. Articulate the definition of adverse childhood experiences, also known as ACEs. 2. Define toxic stress syndrome. 3. Recognize risk factors contributing to ACEs. 4. Explain the effects of ACEs. 5. ACEs and global mental health. 6. Identify suitable ACE screening tools for high-risk patients. 7. Implement appropriate interventions for individuals who have been exposed to ACEs and are at high risk for potential cancer. 8. Early adversity and lasting impacts. Adverse childhood experiences can lead to traumatic brain injury, fractures, burns, depression, anxiety, suicide, PTSD. This all can affect mental health. Maternal health, unattended pregnancies, complications, fetal death, infectious diseases such as HIV and STDs, chronic diseases such as cancer and diabetes, risky behaviors, alcohol and drug abuse, and unsafe sex, opportunities, education, occupation, and income. Adverse childhood experiences have been associated with an increased likelihood of developing cancer later in life. Toxic stress syndrome is caused by ACEs and could lead to changes in the body's stress response system. This can in turn cause inflammation and damage to DNA, which could potentially lead to cancer in the future. ACEs encompass various distressing experiences a child may undergo before the age of 18. This includes physical abuse, sexual abuse, emotional abuse, physical neglect, exposure to domestic violence, emotional neglect, household substance abuse, household mental illness, and parental separation or divorce, and incarcerated household member. Traumatic events can have lasting effects on well-being and health. 1 out of 8 of the population have more than 4 ACEs. 67% of the population have at least 1 ACE. People with 6+ ACEs can die 20 years earlier than those who have none. Adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. 4 or more ACEs could lead to 3 times the level of lung disease and adult smoking, 14 times the number of suicide attempts, 4.5% times more likely to develop depression, 11 times the level of IV drug abuse, 4 times as likely to have begun intercourse by age 15, 2 times the level of liver disease. The effects of ACEs and development of cancer. Research has indicated that individuals who have encountered ACEs face an elevated risk of cancer. Accordingly, it is crucial for children to undergo annual screenings for ACEs, enabling healthcare providers to address any identified issues. Recognizing ACEs early can potentially mitigate the risk of developing cancer later in life. Early detection and prevention play a pivotal role in containing the spread of cancer. Regular screenings enhance the likelihood of early detection of specific cancers before their potential to metastasize. Assessing patients for ACEs risk and exposure is essential. Providing appropriate interventions to mitigate adverse health outcomes associated with ACEs is vital. ACEs and global mental health. There is a significant impact of mental disorders on the global burden of disease, particularly among children and adolescents in low and middle income countries. There is a need for preventative and responsive psychosocial interventions for children, adolescents, and their caregivers. The recently published Global Burden of Diseases reports that reveal the key findings from 2019. Mental disorders were identified as one of the top 10 causes of disease burden worldwide. For years lived with disability and disability-adjusted life years, mental disorders ranked as the second and seventh largest contributors globally, respectively. An estimated 225 million children and adolescents worldwide are living with mental disorders, with 197 million of them residing in low and middle income countries. The impact of the COVID-19 pandemic and related public health and social measures has further aggravated the situation, especially affecting younger individuals. The importance of screening for ACEs. The American Academy of Pediatrics recommends that healthcare providers conduct annual screenings for ACEs as part of routine care. It is shown in research that profound impacts of ACEs on children's physical and mental health, as well as their long-term outcomes. The Centers for Disease Control and Prevention recognizes the significance of screening for ACEs and offers valuable resources for healthcare providers and educators, providing guidance how to effectively identify and respond to these experiences. Multiple studies have demonstrated the effectiveness of interventions and support systems for children and families affected by ACEs, and it highlights the critical importance of early identification and intervention. Factors that can contribute to ACEs and cancer. Risk factors commonly linked to ACEs, such as smoking, alcohol use, drug use, and poor diet, can increase the risk of cancer. The mechanisms through which ACEs may lead to cancer are still being under investigation, but addressing and preventing ACEs can help decrease the risk of cancer. Both physical and psychological abuse significantly impact the association with the development of cancer in the future. Comprehensive questionnaire for ACEs. This is utilized for screening ACEs in both adults and children. The screening process involves the use of specific tools tailored to different age groups, including Pearl's Child Tool, which is specifically designed for children aged 0 to 11. It is intended to be completed by a parent or caregiver who can provide relevant information about the child's experiences. Pearl's Adolescent Tool is geared towards individuals aged 12 to 19 and is also completed by a parent or caregiver to assess the adolescent's exposure to ACEs. Pearls for Adolescent Self-Report Tool is tailored for adolescents aged 12 to 19. This tool allows the adolescents themselves to provide insight into their own experiences. The ACE questionnaire for adults is an adaptation derived from the work of Kaiser Permanente and the Centers for Disease Control and Prevention. Promotion of safe and nurturing relationships for the prevention of ACEs. Preventing ACEs is crucial for promoting the health and well-being of children and families. Research has linked ACEs to increased risk of cancers across all age groups. These experiences can have a significant impact on individuals, families, and communities. It's important to support the need to prevent ACEs. Promoting safe and nurturing relationships, providing parenting education and support, and facilitating access to high-quality early childhood education and care addressing poverty and income inequality, raising awareness about mental health, implementing policies to address community violence and promote safety, and encouraging community involvement is essential. Implementation of prevention of ACEs. Collaborative implementation of these strategies within the community is essential to enhance the prevention of ACEs and create healthier and happier communities where all individuals could thrive. Promotion of safe and stable environments. The primary emphasis of promoting a safe and secure environment is to ensure the safety and well-being of children. In cases where a safe home environment is not accessible, diligent consideration of placement in foster care becomes imperative to safeguard the child's welfare. Early intervention programs. These programs are strategically tailored to proactively identify and address household challenges, enabling timely and targeted interventions to provide essential support to families facing adversity. Professional assistance with ACEs. The involvement of counselors, therapists, and trained professionals is important in offering expert guidance and support to families, with the goal of establishing a healthy and nourishing environment for children. Their interventions play a pivotal role in addressing complex family dynamics and challenges. Teaching resilience and coping mechanisms. It is paramount to prioritize the education of children in developing resilience and effective coping mechanisms, imparting life skills to navigate challenges, circumstances, and adversity. Case study. The family nurse practitioner, while providing care to a 12-year-old boy, was appraised of the parent's ongoing marital discord, which had raised concerns about the potential for ACEs. To mitigate the adverse impacts of the situation, the nurse practitioner should administer the pediatric ACEs and related life event screener, also known as PEARLS, to the child. PEARLS is a screening tool designed to evaluate children and adolescents aged 0 to 19 years for ACEs. For adolescents aged 12 to 19 years, the PEARLS screener is self-administered. The most important first step is assessment of ACEs and applying the appropriate interventions such as referral for therapy. Thank you so much for listening to my presentation. Any feedback and questions are welcome. Again, my name is Vanessa Kaczynski. I'm a DNP student at Wagner College.